Well, thank you all. Welcome everyone to this July session of the VLC, Leveraging Existing Data Sources for Case Matching, made possible in partnership with the CDC Division of Viral Hepatitis. Hi, I'm Zakia Grubbs, not Isabel. She couldn't join us today. And I'm part of the hepatitis team at NASTAD. Joining us today is a moderator for today's session, Shauna Onofrey, Senior Epidemiologist in the Office of Research Evaluation at the Massachusetts Department of Public Health and a member of NASDAQ's HepTAC Advisory Committee, who is joined by Sarah New, epidemiologist with the Surveillance Epidemiology Assessment and Evaluation Session of the STD Control Branch, and Tony Fristachi, HCV Informaticist at the California Department of Public Health. We will get started with a very exciting presentation by Shauna that will feature a new resource we are developing, followed by presentations by Sarah and Tony, and ending with a discussion/Q&A session moderated by Shauna. With that, I will turn it over to Shauna to get us started. Thank you all for your patience again.
Thank you. Am I able to share my screen? Yes. Bear with me a second. All right, you able to see that okay? Wonderful. So hello, everyone. It's nice to see folks. I am here today to talk about a new resource that we are working on creating from NASTAD, which is a data matching toolkit. And when I was talking to Isabel and some other folks about data matching and some of the experience that I had particularly during the COVID pandemic, matching our COVID data with in particular vital registry data. There's a lot that translates from that to viral hepatitis, and we were talking about a lot of the capabilities that come along with doing some data matching, and wanted to really provide something that would be useful to anybody out there who's trying to do data matching, whether it's something you've done before or if it's something that you are completely new to and don't know anything about. So I'm going to give a very broad level overview of what we hope the toolkit will do. And I'm going to include some questions at the end in my slide set, but we can come back to them after the other presentation today to just make sure that this is really going to be a resource that folks feel like is going to be useful to them. So like I said, what we're looking for here is kind of the silver lining of the COVID pandemic for many jurisdictions. COVID tracking really necessitated leveraging other data systems other than their surveillance system. Like I said, from my experience in Massachusetts, I did a lot of matching between our surveillance data and vital records data, but in particular, the death records from our vital records. But really what that has turned into for us is a discussion about how can we use this partnership and this kind of new, I don't really want to say structure, but kind of defined pathway to make this data available for other diseases. And for other jurisdictions, they've really seen this as an opportunity to utilize other data systems or data sets, including improving their address information, connecting with their vaccine registries. And these are all things that we could use for viral hepatitis as well. And so this really provides an opportunity for us to explore using these data sets for other purposes, and may provide folks with kind of the leverage they need to make the argument to use these data sets in their viral hepatitis work. And why match, right? Like, why should we even think about doing this in the first place? I mean, the fact is that other parts of the public health and healthcare system already track many things that we're interested in, and they're better at it than we would be if we started from scratch. And so if there are systems that already capture things that we want to capture, it makes sense to try and utilize the data that they've collected if that's something we can do. There are also a lot of systems that capture the same things we do, like demographics, but may have had a better chance of capturing them on certain folks than we have. And so by comparing that data across different data sets or across different data systems, we can get a sense of maybe where some gaps are, but also potentially improve not only our data, but the data of the other data, but the captured data in the other data system as well. So matching can be used for a lot of things. I'm sure many of you have thought about this, but it can improve completeness of existing variables such as race, ethnicity, and address. And it can provide new information that we don't currently capture. Something else here that's not showing up under Zoom. Oh, or we can provide longitudinal data. So they may capture data at a different point in time than when our surveillance system captured data on an individual. So in particular for viral hepatitis folks, in looking at PS 21-2103, matching may provide solutions for some of these particular outcomes, such as improving the monitoring of burden of disease and trends for Hep A, acute Hep B, and acute Hep C, improved monitoring for continuum of cure, so capturing, including capturing death data, which I know is required, I believe, in year 3 for looking at the continuum of cure. And potentially improve development and utilization of hepatitis surveillance reports, perhaps by bringing in some new or unique data. It may actually broaden the audience for some of these reports. So what we're putting together is a toolkit, and this document is meant to cover matching kind of from soup to nuts. So the goal is to provide the information that you need to take the match from an idea all the way to completion. Hopefully, if I've done my job right, the information provided will be useful to all levels of comfort with data matching. So whether this is something that you've just had the idea to do, but you don't know how to get started, or if it's something that you're like in the middle of. It also includes information on data sets that may be available in your jurisdiction to just help spark ideas. So it talks about other data sets that other jurisdictions have used or that, that may exist in your jurisdiction. So this is the topics that are covered by the toolkit as it is drafted right now. So kind of before you even start with matching, it covers defining the purpose of the match, when you might need a data use agreement, some data cleaning, including variable formats, removing spaces and punctuation, changing case, and then provide some software options for the match. So I'll go over this in the next slide, but right now it includes SAS, R, and Match Pro, and I'll talk about that a little bit later. And then in terms of the match itself, it talks about both exact matching, so really that's kind of merging for folks who are familiar with SAS, but also probabilistic matching, which is also called fuzzy matching. So the this is looking at two variables that might not be an exact match. For example, if my name was in one system as Shauna, Shauna, Onofrey, and in another system as Shawna, Onofrey, which happens regularly, fuzzy matching would identify those two as possible matches and would give you the option to review them and determine if that was a match or not. We also talk a little bit about how to review those and then how this can also be used for deduplication even within your data system. And I know deduplication is a huge issue. both for viral hepatitis and for COVID, and even now for other things. As we get more data in, it becomes more and more of an issue. Many of these processes that we talk about for matching also apply for deduplication. And then finally, like I said, it has some data sets and some ideas of how these data sets might be used. So there are a couple of different types of software covered. Tips on the data preparation include instructions and where appropriate code for Excel, SAS, and R. And then information on actual matching covers SAS, R, and Match Pro, which I'll talk about in the next slide. The language used in both areas should be widely applicable. So even if you were using some other data system that's not covered in this toolkit, what I tried to do was include language that folks would be able to Google and find information on how to do this in a different process. So what is Match Pro? Match Pro is a free software. It's available for download from the National Cancer Institute. So it turns out that the cancer registries have been doing matches for far longer than maybe we've been thinking about this. And they identified pretty early on that they needed a better way to do this. And so Link Plus was the data system that used to be available, and you can still find it on CDC's website. But Match Pro seems to be better supported by the National Cancer Institute. And it's, like I said, a free software. You can conduct probabilistic linkages, so that's fuzzy matching, to find matches between two different fixed width or delimited files. I downloaded it just onto my own home computer. You just fill out a form with like who you are and why you want it. You get a link within 5 minutes. It downloads fast. It's easy to install on your computer. It comes with a full user manual. It's a user-friendly interface. So for folks who are maybe not SAS or R people who don't feel like this is something that they can do in the statistical software packages that they have available, or even if you do, this is a really nice software to use. And there's support available for it as well. So if you were to run into an issue, there's folks who you could reach out to for additional help. And I should say, oops, going the wrong way. I should say that this works on any fixed width or delimited files, and turning your files into either fixed width or delimited files is something that I've covered in the toolkit, but it's actually pretty easy for most software to export or to save your data set as either fixed width or delimited, and you can delimitate through a couple of different things, so either space or comma or tab or various other things. So this is a great option for folks, and it's covered in the toolkit. So I had really hoped in my, maybe time warped sense that this would be done for you guys today. It's not, but we do have a really solid draft of this toolkit. So what I'm hoping is that we can incorporate folks' feedback from today's presentation, but also from the next presentation that's happening, and kind of hear where folks are running into issues with matches. And then put it through review, and we think we'll have a usable document early fall of this year. And I'm hoping that it will really be helpful for a lot of folks who want to move forward with this kind of thing. But I can only make it better with feedback. So I'm going to put this here, and we will hold to cover these until until the end of the discussion, until after the other presentation, but feel free to put things in chat in response to these questions. And I will put up the list of topics at the very end of the session today so that you guys can take a look at that too. But really what I want to know is, are there topics that you don't see listed here that you would like covered? If you're pursuing matching, where are you stuck? Like, what are you having a really hard time with? And then just kind of a general feedback. If Match Pro is something you're interested in, it's got pretty extensive documentation already. What we've done right now is kind of refer people to that documentation for the specifics of using Match Pro. But I'd like to know if folks feel like that's okay, or if that's something that they want us to pull specifically into this toolkit. My concern with pulling it into the toolkit is that it could get outdated at some point, and potentially pretty quickly, depending on how often there are changes to Match Pro. And honestly, as somebody who's new to using that, I've used Link Plus in the past, not Match Pro. I just don't know how often they're making updates to the software. So, so yeah, I'd love to know what folks think about that as well. And that is everything that I have to say today about the toolkit. So we're going to have a presentation by our colleagues here about some of the process that they've gone through with data matching, and then we'll open it up for discussion. So Sarah, I think you can take it away. Tell me if my screen share is green. Tell me if you can't screen share, and then we'll figure it out with NASTAD together.
Okay, let me see. Looks like I'm good.
Good.
Let me go into presentation mode. All right, I'm assuming that everyone can hear me and see my slides.
Yes.
Okay, great. little validation never hurts anybody. So my name is Sarah New. I'm going to actually start off this presentation. I'm a senior epi at the California Department of Public Health. And I'm just going to discuss data linkages and how we use it with our hepatitis C registry. So one thing I want to say is that the SAS program I'm about to go through is really widely used in CDPH by other branches. Basically, it was built like 10 maybe plus years ago, and a lot of people have adapted it. I haven't just used it for this purpose. I've used it to match death records to the hepatitis C registry, to match immunization records to pertussis cases, lots of things. But today I'm just going to focus on how we use it to create our chronic hepatitis C registry. So this is just a little background on how we create our chronic hepatitis C registry. And the first step is just really to merge together all of our new data sources. So this includes CalReady, which is our state surveillance system. This product does some matching. It's deterministic, and it really fails to match everybody correctly. And so typically we have to do some sort of deduplication on the back end, no matter what condition you're doing surveillance with. We also have instant level data from local health jurisdictions that do not report to CalReady, and electronic laboratory data reported by Quest directly to us in a line-less fashion. Then we match the new data to the last version of our hepatitis C registry, and then we deduplicate these matches after the process is finished. And I should say that the match process is probabilistic based on fuzzy matching, as was discussed before. The final product gives us 2 registries, one which is the person level registry and the other which is the incident level registry. And today we'll be focusing on step 2 in this process. So I apologize, I have a Malinois and she's got a very good bark. So we use a SAS program, an in-house SAS program that was written by a former colleague of mine, Glenn Wright. And he published a paper on this method, which I've linked to in this slide set. If you want more details about this at any point after this presentation. Like I said, it's a probabilistic matching algorithm, which uses a point-based system that creates similarity scores. The point system rewards higher points to how close a match is. And it also uses this really nice nickname file to be included when it's doing first name matching. So now getting a little more into the weeds. I know this is like SAS code. If you like it, you're gonna love it. If you hate coding and stuff, this is like your worst nightmare, but just hang with me. I'll give you a general overview. So in the first step of the matching process, we standardize the data, which is obviously a very common step prior to doing a matching procedure. And then in the second step, the program assigns these logarithmic weights for comparison based on frequency of certain variables like first and last name. For example, a less frequent name in the data set is assigned more weight. So Sarah would be weighted with a less frequent name is assigned more weight. So Sarah, which is a pretty common name, would be assigned less weight than perhaps a name like Pearl. These weights are applied when calculated the similarity scores in the main linkage algorithm. And the method of assigning weights is described in more detail in Glenn's published paper, but it essentially is used to decrease the similarity score for common information. So it's a nice little adjustment. Oh, there's my example. And in step 3, we run the main pair finding code, which uses a SAS macro to calculate similarity scores. So this portion of the program creates a Cartesian product, cross-checking every person in the new data to every record in the old registry to identify every possible pair. There's a comparison of a number of variables across one linked set. For example, the similarity of first name, last name, date of birth, zip code, etc., to create a similarity score that estimates how certain we can be that these two cases are the same person. The higher the similarity score, the greater the likelihood that the record pair is a match. And this code is very flexible and accounts for numerous variations in variables that may be present, with scores being highest for exact matches and penalizations for complete disagreements. And the reason I put the code in here is because you can really see the flexibility that is given with like date of birth, for example. This really, like, it takes into account if the month or date are flipped, if it's in a relatively close, like within a week of the date of birth, like it will assign it a score versus just considering it as a complete disagreement or not a match. Step 4 illustrates how we run the macro and optimize performance. So we do this using a technique called blocking. And blocking just means that before SAS assigns these similarity scores, so before it actually runs through all of these different cases listed on the listed under step 3, it checks to make sure there is at least some preliminary evidence that 2 records refer to the same entity. Thus, here we check to see if observations match first on key non-missing variables such as social security number, date of birth, first name, and last name. And I would say that the nice part of this program is that you can adjust any part of this code as needed, adding and deleting variables and then making adjustments to similarity scores. So it makes it very, very user-friendly when a lot of those like off-the-shelf software, you don't have this much control over the way things are assigned. So in this slide, talking about the kind of like the final product that we get out of this matching algorithm or the SAS program. The SAS output from our matching score includes a pair of records and a value called total score, which is the sum of all of the individual similarity scores. But we still need a way to choose a threshold above which 2 records are considered a match. And so we assume that observations with a high total score are likely pairs that do represent the same person, and that observations with a low total score are likely pairs that do not represent the same person. But how do we know still where to draw this line and this cutoff point? So in summary, our output includes a bimodal distribution shown in this histogram here. There should be a very large peak in the lower range of total scores and a much smaller peak in the higher range of scores. And the bimodal distribution also confirms that this method is working correctly. This occurs because the histogram shows every single pair of observations, both those that do not refer to the same entity and those that do, and the number of non-matching pairs is much greater than the number of matching pairs. So if we have chosen our method well, most of the true matches will fall under the small high scoring peak of the histogram, whereas most of our false matches will fall under the large low scoring peak of this histogram. Thus, we pick a total score within this trough, where everything above it represents a match and everything below it is discarded. So if you're looking at this histogram, this is what you get kind of as the output. You're looking, you can clearly see sort of where the dip is in between the distribution on the left and the distribution on the right. And this is where you can kind of go in and do a couple of things. You can just say, okay, I'm going to cut it off right here at about 35. That seems like the midpoint of this trough, and everything above that is a match and everything below that is not a match. Or you can say, okay, maybe I should look at this 33 to 38 range and just make sure that I'm comfortable with my thresholds and move on from there. So our final product is this data set of linked pairs with all high scoring matched observations based on whatever your cutoff value is. And then our final step, which I'm not going to get too into detail about, is our deduplication process. So after we created our linked pairs data set, we use another in-house program to deduplicate the data. And this was also created by the same programmer, Glenn Wright, and more details are published online. But in short, the SAS program uses hash objects to transform the linked pairs into a file of cluster records with a new common identifier. Clearly, the linked pairs are redundant after matching, so this program cleans that up and gives us a matched deduplicated patient level registry. So just kind of discussing the issues with this program. And in general, it always takes a very long time to do the match depending on the data set sizes that you are matching. For the Hepatitis C registry, it has historically taken about 3 days to run. And then we broke it. So we tried to do an inner join of about 8 million records, and an inner join is just matching the same data set to the same data set. And we ran out of memory. And then we tried to overcome this issue by matching only new data, which was about 2 million records, to our old registry, which was about 6 million records. And it worked, but it created a linked pairs file with about 36 million records. So you can see like whatever you're matching just exponentially increases, and the final product is very large until you select your threshold and then deduplicate it. So that's all a lot of processing time. Hence is why we broke it again. So we tried to run the deduplication process and we ran out of memory. And the deduplication process uses hash objects. We kind of call it the black box because not all of us understand how to work with it. So it makes it much, much more difficult to troubleshoot compared to the matching program that I discussed before. So now I will transition over to Tony, who included this nice transition slide to show where we started and where he is now taking us into our 2.0 of our hepatitis C registry.
Good afternoon, everyone. Is it afternoon there? Okay, it is here. It's 3:30 where I'm at. Anyway, so yeah, there are more problems that I encountered that what Sarah brought up. So I had to really think about fixing what we have was not really an option. So I pretty much blew everything up and started from scratch. The current situation, the current method was to recreate the registry from scratch every month. And it's not computationally effective, especially in SAS, which do things by rows. And the link ID that was created with the probabilistic matching was flawed. We had different individuals with the same link ID, and some individuals had different link IDs. The same individual had different link IDs. And the deduplication method, in my opinion, was more complicated than it needed to be. And there were inconsistent formatting issues as well. Next, please. Okay, so towards developing this new registry, I imported and cleaned up the legacy data set, standardized names, data sources, last name, first names, things of that nature, removed complete duplicates, and any observation that did not have a last name, sex, date of birth, or LHJ. And wound up getting rid of 2% of the data up to March 14th of this year. So we have a little over 5.5 million records with the SAStat data set of 18 gigabytes. Another issue that we had is we currently have no ELR data, laboratory data for Los Angeles or San Diego. Those are 2 non-participating jurisdictions. And I keep trying. It's an ongoing process. Have to deal with some higher ups, so it's turned into a political kind of thing that I have to deal with. Also, there's no longer a linked ID. If there's a CalReady, if you don't know, CalReady is our computerized system for tracking infectious diseases, and if it started out in 2010. So if there's no CalReady ID, if there was a CalReady ID associated with any of the observations that were linked at one time, then person ID was assigned for that person. And if person ID was still missing, we temporarily just substituted the link ID and added the distinction of some leading zeros. But at the end of the process, I'm going to match and all the data on the first run. Next slide, please. Okay, so the new data. So basically, we get CalReady data, Los Angeles data, San Diego. I neglected to put that in here, and San Francisco data, and then my main. Since having come from working as a data unit lead for COVID for California, we migrated everything up to a cloud-based system, and there really wasn't quite necessary for hepatitis C because we don't really have real-time data, but using a SQL server definitely was. It allows us, number one, to use SQL, allows us to get rid of SAS, which I'm too fond of, and essentially, excuse me, utilize within our studio server to automate the process that we need to do each month. So the data comes in, we do cleanup, and deduplication. That's done with SQL into in the server, and it's also done in the RStudio server as well. And then what we do is append all the cleanup data into the incident level data set. And then we run the record linkage package with all this new data, and we see what kind of matches we get that we didn't get before. And I'll get into how that's done. And then when we, after all of that is cleaned up, we append the person level data set, which has aggregated data for individuals. Next, please. So the architecture of this is we get raw data files from CalReady and from the non-participating jurisdictions. That's what MPJ is. And currently things are running as SAS because it took a while to get the SQL server. Eventually everything is going to be in SQL server and we won't be using SAS anymore. So the data comes in, there's a bunch of formatting that needs to get done to make sure everything is consistent with the existing data. And and then we then it gets pulled into the RStudio server, and then we, utilizing the record linkage package, we do matching on all the data, the new data that's coming in against all the old data. And since we're only really bringing in CalReady data, we're not matching it to anything that was in the system before 2010. So that's considerable amount of data since I think the earliest record we have is 1999. So anyway, so the linkage and deduplication happens, and we send the data back to the SQL server, and where it's stored in the instant database. And we also go at the RStudio server in the light blue arrow goes straight into and appends to the person level data set. And the person level data set is pretty much the one that most of the EPIs utilize for the different types of analyses. Next, please. So a lot of extensive matching is no longer necessary since person ID is set in the CalReady system, and but matching to the old data is still necessary. As I said before, we connect to the SQL server, to R, and we do the deduplication and matching and send the events back to the SQL server. This is basically reiterating what I just talked about. Next slide, please. So you import the last 3 years worth of data from the data production, going into the CalReady data warehouse. We pull these two files out, and we also pull non-participating jurisdictional data that also is flat files. And then we import the HCV incident file into R. Next one. And this is just simple. What we, right now it's being done in SAS, but eventually be done in SQL, and we'll just pop out CSV files. For these are the 3 files that we need to bring in: incident level, the CalReady, excuse me, and the MPJ. Next, please. So record linkage. Now, definition of record linkage. Determine if pairs data records described belong to the same entity, join those relations, and remove duplicates from a single relation. So I found out about record linkage package through some colleagues of mine working on COVID, who were when we started getting more vaccine data in, it didn't come in through the CalReady system. So we had to be able to match cases that we had with vaccination records. And the record linkage package, pardon me, uses methods based on the stochastic approach, but also uses algorithms that's used in machine learning. And you can find more about that package with this link. Next slide, please. So this is the general setup. I haven't really worked with this a whole lot yet, but this is just the first run of things. First you get your two files, and you see here we have CalReady and incident, and those are the two files we want to compare with. And so the block field option specifies the columns with the two records must agree to be included in the output. It could be anything, as with the SAS program that Sarah showed. You could do things anyway. This is what I was just using at the time when I made these slides. And the STR-CMP are columns in which the comparisons are being ran on. So essentially, we want to see the same last name. In this case, the same last name and first name matches to the date of birth. And just for this run, we're not going to look at person ID. We're not going to look at sex, and we're not going to look at LHJ. But those could eventually in block field we would include sex and LHJ, and would eventually get the person ID out of it that way. And then so once we create this pairs data set, then we the epi classified function classifies the records as record pairs as link, non-link, or possible link based on weights that are expectation maximization algorithm is what they call it, and that's what's utilized to come up with these weights, and it gets classified from with 5%. 95% accuracy. You can change that. How close do you want the match to be? What's acceptable? It's kind of almost ad hoc. Nothing is, it depends on how messed up your data is also, I guess. But in any given scenario, you can decide how close things need to be. What's your alpha? And then you run it through, and you can match the two data sets together, and you can see which, and then basically you get a data set that has the epi weights for all your observations, and then you could just do simple. Use simple methods to figure out where you don't have matches and where you do have matches. Next slide, please. And then after the matching is done, and that should be person IDs. Sorry, person IDs have been signed. The data is deduplicated and merged, and we do a simple SQL statement to utilize that. We also would include the incident ID on this also, because you don't want, this is I did for person level, but you would also include incident ID. So each incident has its own identification number that's associated with that patient ID. So you would, in this case, you would have select distinct incident ID, distinct patient ID, which basically says, I want distinct incident IDs for this patient, and also these other variables that tag along. But we definitely look for distinct. And for instance, when I first ran through data set, I just did a simple select distinct asterisk, and basically it it just pulled individual records, all of observation, all the variable fields were exactly the same. So that's where that 2% came from, mostly from that kind of stuff. And then the rest was missing LHJs. So anyway, next slide. I think that's it. Okay, and then after we've done the deduplication, after we've done the matching, we have an incident level data set that we're really happy with, and then utilizing R, we aggregate this data. So for a given patient ID, you know, we have all the demographics for what they are, and then we also have when we first had a record for them, what was the date, the last time, what was the date, same for classified and confirmed for all of these metrics. And then we also have a genotype field, and then we also have a current case status field. And with that, I think that is the last slide. It is. Thank you for your time.
Thank you guys, Tony and Sarah, for presenting today. I see that there's a question in the chat from Lindsay directed to Sarah that says, thank you for showing the SAS code so we could see how easy it would be to adjust. I'm curious what kind of adjustments you tend to find yourself making and if it has varied depending on the project or the disease.
So I haven't adjusted the similarity scores that much, although I will say one of the cases in this program has to do with whether someone is incarcerated or not. And so that is kind of something that is, I think, pretty, I mean, it could be other conditions too, but certainly very relative to Hep C. So that's kind of something, it's probably more so like we've added variables to add into the similarity score calculation based on diseases like that. And then the other thing that I'll say in terms of things that I've messed with is the weighting, actually. And I think I bring this up in one of our discussion questions because I'm very interested in kind of how people deal with this. But something that I've noticed over my time of doing all these matches is that certain naming conventions, like how people do their surnames and certain cultures if like, for example, if someone has like if they take in like a maternal and a paternal name and combine them, sometimes these end up being really low matches on the output. And so I've kind of done things where I've weighted them and boosted those matches to get them to sort of their total scores to come up a little bit so that we don't lose some of these people that might be particularly of like race or ethnicity backgrounds of interest. So yeah, I think that's mostly what I've done. I would say that if some data is pretty unreliable, you probably don't want it in there anyways, but it is nice. Like you could also like we ding things for disagreements by like -11, and you could be like, well, I don't really want to ding a bad last name as much as I want to ding like a first name. So you could make that adjustment. So it's kind of really nice in that manual sense.
Thank you for that. Sarah, I laughed when you said it took 3 days to run. We had done a match ages ago of a former colleague of mine when I was still working more with viral hepatitis, and we tried to match our hepatitis data with our death data using desktop SAS, and I think it took her 5 days to run and then crashed her computer as well. So yeah, it does take a lot of processing power to do a lot of this. And I appreciated that both you and Tony talked about, there's trade-offs to making some of these adjustments. I think a lot of this matching process, there's a bit of art to it, thinking about what the trade-off is going to be, and you can trade some accuracy for some speed, depending on how close you really want these matches to be and how much manual review you want to do.
Yeah, I agree. I can't tell you, there is nothing more deflating than coming back multiple times in a row after 3 days, because you run it on Friday, you come back in on a Monday, and the first thing Monday morning you see is that your memory ran out. I mean, we have a whole separate computer that we only use to run this registry, and it has more processing power. I think there's probably other ways to get around that memory thresholds. But the other thing I'll say is SAS help has been a really nice resource when I do run out of memory to try to figure out what's going on. But yeah, it can be very deflating to come back in week after week and just be, oh, it's not working again. And then you don't know for 3 days, did it work? And yeah, I agree.
So I'm opening the floor to questions. Does anybody else have questions or comments for Sarah, Tony, or I? And I can pull up that slide too if folks are interested on what will be covered, although I already have made some additional notes about, or maybe I'll put it in the chat, about what we might want to add to this toolkit and thinking about some of what Sarah and Tony presented. Does anybody have any questions? Sarah, do you maybe want to talk about some of the data sources you are routinely linking?
Routinely is a tough word because we're
Sure.
trying to fix it. Right now, I mean, the ones that I mentioned, the Cowredy, that's basically just like trying to get all the information into one place. We do need to do routine death matches because clearly we need to know who's died and who's still surviving in our state. Trying to think of other things that we have matched. We've done cancer matches in the past, but kind of what you were speaking to earlier, they've been doing this for so long that we actually don't, they prefer their algorithm over ours. So
Yeah.
we send them the data and they do it using the process that you described earlier. We do also link HIV data to our Hep C data. They again prefer their matching algorithm over ours, so they run their own program. So it's all interesting about like who. It's like once you've used your matching program, you kind of get stuck on it and you're like, no, this is the best. I'm going to use this because I don't trust anyone else's. And so it's been, Tony and I, it's been interesting to sort of work parallel on the same goal. And you know, it's going to be interesting on the back half to see like how they perform against each other.
I have pulled up here. Am I still muted? No, I have pulled up here some of the topics that are covered. Just if anybody has additional things they'd like to see covered in the toolkit that we're working on. And if, you know, folks think about this and want to send comments to Isabel or other folks at NASTAD, or if you have my contact information, you want to send it directly to me, I'm happy to take feedback. If anyone wants to like give this a test run once it's ready, we'd be happy to take those kind of volunteers as well. Or if you're working on matches right now and you're stuck, you know, I'm happy to see if we can get you in touch with folks who can help before this toolkit is ready. And I can see that there is the request for filling out the evaluation about this session. So please make sure you do that. It does help us make sure that the sessions are more useful for everybody. And I also see the comment here about kind of common issues and how to overcome them, Sarah. Yeah, I think absolutely. A lot of what you have mentioned is the same thing that I think you run into, regardless of what you're trying to match with. Tried to cover some of both the data cleaning issues that Tony talked about too, inconsistent formatting and stuff like that. But we'll try and make sure as many common issues are covered as can be. I hope that everyone enjoyed the session today. Please make sure that you fill out your evaluation, and thanks everybody very much for attending.
Thank you. Have a good rest of your day.
Thank you, Shauna, Sarah, and Tony. And thank you all for attending today. And thank you all for completing the first year of the VLC. So thank you all so much for that. And please let us know if there's any content you all would like to see in year 2. So thank you. Have a good one.